Hacemos de todo tipo de cirugías, Botox, fillers, lo que se puedan imaginar.
Facial procedures like eyelid surgery, tummy tucks, anything for mommy makeovers. And so typically with liposuction, we can take up to 10 pounds of pure fat in one day.
Yo sé que ahorita es muy popular el relleno de labios. Él lo hace, rinoplastia, que él también la hace. Por eso las personas se van a otros estados, porque pues no saben. So, él es uno de los únicos que hace eso aquí.
Entonces no hay necesidad de salir del estado,
No,
necesidad
aquí.
de salir del país, de la ciudad, absolutamente nada. Aquí en Minnesota, Twin Cities, aquí los tienen ustedes.
Yes, you have us here, right?
That's right, yeah.
¿Y qué tal si alguien quiere una cinturita acá de avispa de sirenita?
Dr. Schneider es experto en eso. También los hombres adquieren Botox, relleno. Tenemos de todo tipo de pacientes.
Hi, you guys. Welcome back to another podcast of El.mn. Today, we have two special guests. And trust me, you guys want to stay until the end of this podcast. Porque lo que se viene es algo muy importante para nuestra comunidad y para nuestra gente aquí en Minnesota. So, I'm going to let you guys introduce yourself and tell us what it is that you guys do.
After you, please.
Yo soy Anaí, soy enfermera de cirugía plástica. Trabajo con el Dr. Schneider. Hacemos de todo tipo de cirugías, Botox, fillers, lo que se puedan imaginar, y estamos aquí para darles un poquito más de información e invitarlos a que vengan a conocernos y consulten con nosotros si tienen alguna necesidad estética.
Yes, my name is Dr. Daniel Schneider, and I perform mostly cosmetic surgery here in the St. Paul, Minneapolis area. And I have the pleasure of working with Liz and Anai and Jose today, and just wanted to give the Spanish community as well as the greater, Twin City community information about where they can get cosmetic services, whether, like Anai mentioned, whether it's Botox, filler, facial procedures like eyelid surgery, tummy tucks, anything for mommy makeovers. Letting people know that they can get those services closer to home so that they don't need to travel out of state or out of country. And so we wanted to just have a little bit of a Q&A and provide some more information about that.
Bueno, chicos, ya lo escucharon, ¿eh? Así que se tienen que quedar a ver este podcast hasta el final porque pues tienen mucha información que van a dar ellos. También vamos a tener algunas preguntas aquí que pues nos la van a contestar. Igual en inglés y en español. Nuestro cirujano aquí, él habla inglés, pero pues Anaí está aquí, que es parte de este negocio, podemos decirlo. Y pues ella es enfermera, habla inglés y español, así que no se lo pueden perder, ¿eh? Well, let's get started, you guys, because I know that everyone here probably has a lot of questions. But tell us, how long have you guys been doing this? This part of like surgery and like the location that you guys have been at?
Yes, I've been practicing in the St. Paul, Minneapolis community now for 11 years. And I've had my own clinic just south of St. Paul for the last 7 years. And at that site, we've been doing, a variety of different services that people inquire about, but everything from non-invasive things to more invasive surgery. So yeah, that would be about it for how long we've been there.
Mm-hmm. And what about you, Anaí?
Inglés o español.
Como gustes, como tú te sientes a gusto.
He trabajado en cirugía plástica aproximadamente 1 año y medio. Es algo que me gusta mucho. Estar ahí para apoyar a la paciente en el proceso, ya sea preoperatorio, intraoperatorio, postoperatorio. Es algo que me gusta hacer mucho.
¿Sí? Bueno, you guys, so for me to know that a Latina is doing this, it makes me feel so proud. So I think that this is obviously going to help our community even more. Y pues también gracias a ella que habla español, ustedes se pueden informar. Where is it that they can find you guys? Like the location, social media?
Yeah, the best place is probably on our Instagram or our website, which is riverviewfacialplasticsurgery.com. Or if you just type in Riverview Facial Plastic Surgery, you'll see our Instagram, and then you can message us and follow us there to get more information.
And if you do a Google search, Dr. Schneider pops up right up there as like Minnesota's best plastic surgeon. So just so you guys know.
Okay, so even Google has you guys.
Google has us,
Yep. Yeah, and so we really want to, the primary procedures we really feature would be like liposuction with or without, skin removal, whether you're doing a tummy tuck, an underarm, a thigh, or a facelift, neck lift. Those are the main surgeries that we do, but we do a lot of other services that people don't necessarily need to go right to surgery. Maybe they want to try Botox. Maybe they want to have a aesthetic facial with one of our estheticians. Or maybe they want to do non-invasive altogether, like cool sculpting for getting rid of any kind of pinchable fat. So there's a lot of different options for people.
So definitely you guys have like all options depending on like the patient, depending on what they can afford, or what is this depending on?
Do you want to? Yeah, so a lot of different people come with different needs or wants. Some just want to do something simple, like they just maybe have lines by the corner of their eyes or on their forehead and they want to just do Botox, or maybe they want to do our weight loss program because they want to get rid of weight as naturally as they can, but they don't want to do surgery yet. Or maybe they're just, they've had their children and they want to have a mommy makeover. They want to get rid of the extra pinchable fat with liposuction, with or without any kind of extra skin removal if they need that. So we always encourage people to come for an in-person consultation. We don't charge for the consultations, and usually we leave plenty of time for that so that we're not rushing through. One thing that's kind of unique about the clinic that we work at is that usually on any given surgical day we only do one procedure. So we're not going to rush the person. We're going to make sure that they're comfortable, and whether they need like a Spanish interpreter with certain days with an eye, or other. They have other special needs with, transportation or communication, we can accommodate that.
Wow, you guys do the whole package.
Everything.
So,
and also, we do minimal sedation, so people aren't completely under if they're afraid of that, but we also do provide general anesthesia where they are asleep during the whole procedure. Así es que somos un poquito flexibles para que la persona se sienta cómoda.
Claro.
Y pues, we're here to cater to our patients.
Right.
Entonces, cuando están haciendo estas cirugías, tú, Anaí, ¿qué es lo que haces? ¿Qué es tu parte en esto?
Yo lo asisto, cuando llega el paciente, yo lo preparo para la cirugía. Entonces, le tomo los signos vitales, lo medico, y ya luego Dr. Schneider viene y marca lo que va a hacer, y ya yo ayudo al paciente a entrar al cuarto quirúrgico. Ya ahí yo estoy monitoreando los signos vitales, dependiendo de la cirugía. La mayoría del tiempo yo también asisto durante las cirugías. Por ejemplo, si está haciendo un skin removal, yo estoy ahí ayudándole no quiero ser muy gráfica, pero ayudándole para que todo surja bien, ayudándole cuando le está suturando. Siempre estoy ahí, y si la persona está bajo minimal sedation, pues chequeando que la persona esté bien, que esté cómoda, que no le haga falta nada, que esté tranquila y relajada.
Mira, entonces tú tienes algo que ver, o sea, en todo el proceso, desde que comienza hasta que termina.
Sí, desde la cita preoperativa yo los preparo, les doy su lista de lo que van a necesitar, mando sus prescripciones a las farmacias, ya durante cirugía hago lo que te expliqué, doy instrucciones para el cuidado postoperatorio, y de ahí pues les doy seguimiento para asegurarme que estén bien, que no tengan ningún problema.
¿Y qué es lo que se necesita para, por ejemplo, tú tener una operación? So what is it that you need in order for you to get surgery? Or does it depend on what kind of surgery you're going for?
Yeah, usually we want everyone to come for a consultation just to meet me, the staff, and other people involved in their care so that they feel comfortable. It's not an unknown thing. And so then we'll have a 30 to 60-minute consultation with them where we can discuss everything that they have concerns about, what their worries are, what their fears may be, what their goals are. And so we usually take quite a bit of time. Typically we do that in the afternoon after our surgical days, or like on Monday and Fridays where we just see consults and do more minimally invasive type appointments. So that would be probably the first step. If people have a cosmetic need or inquiry and they want to just get more information, I would encourage them to just schedule a consultation so that they can assess if they're a good candidate. Do they have other health concerns that we need to work on, or are they healthy and fit for surgery right away or not?
And then let's say if someone wants to like lose weight, is that something you guys recommend most of the time if they want to do any type of surgery? Especially if they're like, you know what, I want to obviously change my lifestyle and feel good inside and out.
Usually the weight loss is tough. Most people they've already tried that for a long time, and now they want to see what else they can do beyond like these yo-yo diets and things like that. So typically that person would be within a reasonable weight. They're not extremely overweight, but maybe they just need to lose 5 or 10 pounds. And so typically with liposuction we can take up to 10 pounds of pure fat in one day. And so that's fat that will never come back, because our fat cells in our body, they don't actually replicate. We only have a certain number of them, and so when we take them away with liposuction, those ones are gone for good.
Bueno, pues en el estado de Minnesota hay un límite de 10 libras que podemos quitar por cirugía. Esas, obviamente estamos liposuccionando las células de, how do you say fat cells in Spanish?
¿Células de grasa?
Estamos removiendo las células de grasa, esas células ya no regresan. Entonces estamos removiendo todo eso, y así como continúa la persona, ya no pueden regenerar esas células de gordura. Entonces la persona ya no vuelve a subir de peso en esa área. Usualmente las personas que vienen a recibir o adquirir liposucción son personas que ya han intentado dietas, fasting, X cosa, y no pueden perder el peso. Entonces nosotros le ayudamos con eso, y pues ya no vuelve a regenerar, ya no vuelve a subir de peso en esa área. Aparte, Dr. Schneider tiene weight loss programs, right?
Yeah, we do have a weight loss program. Let's say people are maybe 50 or even up to 100 pounds overweight, and they want to really lose weight quickly. We do a low-calorie hormone diet that people sometimes will do prior to doing liposuction, but it's not necessary, for everyone. So I would say it's, some patients don't want to do surgery. Maybe they just want to try to do weight loss. That would be a good option for them. But those that, let's say, they want to just work on their core, they want to really treat their abdomen or their love handles or other areas that have pinchable fat, then that would be more liposuction and a procedure. But if they just want to globally lose weight and they want to do that as naturally as possible, or without surgery or recovery, then they can do the weight loss.
So there's definitely a lot of benefits to getting surgery, right?
Yeah, and I would say the best thing is doing that consult, because we can really assess them and we can see what they've tried. Do they have other health concerns like diabetes, high blood pressure? Are they a good candidate for surgery? Because not everybody is a good candidate, or maybe they just have fears or they have a lot of questions, and so we can help them through that process.
For example, if someone has diabetes, does that still mean like, they can still get surgery? Or does that mean like, we probably have to monitor?
Yeah, usually diabetes, we want to make sure that they're getting treatment, first of all, because we don't want to do any kind of elective surgery if they aren't, seeing their primary doctor and having treatment for that. But once that's being done, then, there are criteria where you would say, well, maybe you need to work on your diabetes a little bit more before you have surgery. So they have like blood levels that they check with their primary doctor usually for that.
We would have them, pediríamos que vean a su doctor de their primary care doctor, que les tomen sangre y para ver si los niveles del A1C están donde tienen que estar para que puedan tener una cirugía sin ningún riesgo.
Entonces, diabetes no significa que no puedan tener.
Claro que no, he tenido muchos pacientes. Solamente durante la cirugía sí les estoy chequeando el azúcar cada hora, solo para asegurarme que todo esté bajo control.
Entonces, para nuestra gente que gusta tener un tipo de cirugía, no significa que al tener diabetes no se lo pueda hacer, ¿verdad?
Claro que no. Igual las personas con la presión alta, tenemos medicamentos para bajar la presión antes de cirugía para que todo esté bien durante el proceso. Entonces, todo se puede resolver.
Mira, pues, creo que esta oportunidad, chicos, no se la pueden perder. Mandarle mensaje aquí a nuestro cirujano, a Anaí, que ella pues les puede contestar sus preguntas en español. Así que no pueden tener ninguna excusa para mandar un mensaje.
Así es.
Do you want to tell us more about like Botox? What is it that
Sure, yeah.
you guys do?
Absolutely. So Botox, like if someone was to come for a consult or just, maybe they want to do a Botox treatment, we can do those on the same day as their initial appointment. That usually just takes maybe 15 or 20 minutes. So Botox, there aren't a lot of reasons not to get Botox. It's going to help pretty much everybody with the upper part of their face primarily. So areas around the eyes, the forehead, and between the eyebrows are the most commonly treated areas. And so that's quite simple. And I'd say most of our patients now are probably in their 30s to 50s that get that, but there are some that are starting even at a younger age to prevent the wrinkles from forming in the first place. And so that would be a very simple, straightforward kind of anti-aging treatment that is quite common. It generally lasts 3 to 4 months. Even if you do it once or twice a year, it's helpful.
Very helpful. It makes a big difference.
And then other things like fillers, we put volume back into people's face, whether it's, in the areas under the eyes here, the nasal fold here, the temple, along the jawline, areas that as we age, or maybe we're just born this way, or we're, younger, we just want to stay youthful, adding volume back can be quite helpful.
So there is definitely a difference between Botox and fillers.
Yes, very much
There's
so.
a big difference.
Yeah.
Mm-hmm.
The Botox really works on the muscle that's working under our face that's causing the line to begin with, whereas the filler is adding volume to areas that maybe have a shadow or a depression that needs a little bit something, volumized under the skin. And then, of course, there's just skincare. So we also provide like skincare products for, anti-aging, for, sun exposure, different types of peptides, vitamin C, vitamin A, cleansers, things like that, just to protect the skin.
And anyone can get this, like Botox and fillers, or let's say that they have a condition, I don't know.
Very unlikely that you can't get Botox.
Okay.
Usually the main reasons not to get Botox is that you have like a neurological condition. There's a certain small number of diseases where people that have like muscle diseases wouldn't want to get Botox electively, or if they have an allergy, or if they're pregnant. Those are the 3 kind of reasons not to get Botox.
Dr. Schneider also does everybody's favorite. Yo sé que ahorita es muy popular el relleno de labios. Él lo hace.
Yes.
Tenemos algo que es alternativo a la rinoplastia, que él también la hace, pero la tenemos le llamamos liquid rhinoplasty, y hace una gran diferencia en la nariz. De hecho, él me lo hizo a mí, solamente con poquito relleno aquí, y te cambia la estructura de la nariz y la cara por completo. Entonces también ofrecemos eso.
Y para eso no tienen que como dormirte, no tienen que ponerte anestesia.
Una anestesia, ¿cómo se dice? Topical, nada más, o sea, aquí
Like a numbing.
sobre la piel se pone un poquito, como por ejemplo a mí me puse aquí y no se siente nada, o sea, absolutamente nada, y en el momento inmediatamente se ven los resultados. De hecho, él tiene un video mío en el Instagram donde pueden ver mi sorpresa al ver el cambio tan drástico con poco relleno.
Bueno, tenemos que pasar ese video porque también nuestra gente se tiene que convencer, ¿no? De que realmente esto funciona.
Sí, funciona.
Y por ejemplo, ¿eso cuánto tiempo te dura? ¿Te dura también de 3 a 4 meses o dura más?
Liquid rhinoplasty, a year and a half to 2 years.
Yeah, and it might last a little bit longer. Some of the fillers that we use do last a bit longer than that, and the nose is really good for that kind of filler because it doesn't move that much. Unlike the lips or the cheeks where there's a little bit more motion, it might not last as long, but the nose, with the type of fillers that we use, usually will have at least 12 to 18 months or maybe longer.
Wow,
And
you
it's
guys
a lot less
can convince here.
expensive. and a
Completely
lot-
painless, o sea, no duele nada, no hay moretes, o sea, nada. Como que si no pasó nada, solamente ves el cambio en tu cara. Es algo muy mínimo, very minimal invasion, right? It's
Yes,
not.
yeah, it's just a tiny, small
Go get it
needle.
on your lunch break. En la hora de la comida vayan
Y
y
ya
que les
estás
pongan
bien
el relleno
para el
y
trabajo.
regresas al trabajo. Sí.
So what is the most common surgery for you guys, or the most frequent surgery that is requested?
Yeah, I would say it's probably, there's 3 things that we do the most common of for surgery. That would be liposuction, with or without removal of skin after liposuction. That would be probably the number 1. And then facelifts and neck lifts for people that are aging. Maybe they're in their 40s to 60s and they're getting some jowling or loose skin in their neck. So, correcting that so that they can continue to feel, youthful and match that with their appearance. Because a lot of people, even though we're getting older, we're living longer, healthier, and then our skin and our volume in our face and our body doesn't necessarily match how we want to feel or how we do feel. So I would say those are the big two. And then, anywhere where people have extra skin. The typical spots are the abdomen or the stomach area, the inner thigh, underarm, face and neck. So those would be the big surgical areas.
And I think Dr. Schneider is there are not many doctors here or surgeons in Minnesota that do like the thigh lift and the arm lift. So él es uno de los únicos que hace eso aquí. Por eso las personas se van a otros estados, porque pues no saben, pero él sí, o sea, acabamos de hacer uno la semana pasada. Last week is when we did the arm and thigh lift.
Yep.
Entonces es un procedimiento rápido también, o sea, no tienes que estar como cuando te vas a otro estado o a otro país que te tienes que quedar en el hospital un día y pagar tu enfermera personal y así, o sea, aquí no es necesario. Te recuperamos, si es anestesia mínima, en 15 minutos, te cambio, te pongo tu faja, te alisto y te puedes ir. Si es bajo anestesia general, 1 hora te estamos observando, igual, le pongo la faja, la cambio a la persona y ya se pueden ir a su casa. Y damos seguimiento muy personal. Dr. Schneider les da su número de celular, estamos chequeando, llamando a la persona, asegurándonos que esté bien, que no le haga falta nada. Las vemos a 1 semana después de la cirugía también, ya sea la cirugía que sea. Y pues les damos un seguimiento muy personalizado, muy cercano también.
Entonces no hay necesidad de salir del estado, necesidad de salir del país, de la ciudad, absolutamente nada. Aquí en Minnesota, Twin Cities, aquí los tienen ustedes.
Yes, you have us here, right?
That's right, yeah. Right, and we really want to just focus on, like when we do a surgery, it's just one person a day. Because we found, I've worked in a lot of different settings where we might see, 20 patients in a day, and maybe we'll have 5 or 6 surgeries. And so as we all know, society is getting busier and the demands are more, but at our office we really want to just focus on one person a day and make that kind of our goal so that their needs are met and we're not burning out and they're getting all the services and attention that they need.
Miren, chicos, lo que acaba de mencionar es algo muy importante y yo como una persona que da un servicio siento que esto es algo muy importante para mis clientes también. Por ejemplo, ellos nada más se enfocan en una persona al día, o sea, un paciente al día, que eso para mí significa que you guys give the best of the best service. Before, during, and after care. So eso, I think it's amazing. I mean, I'm sold just by that.
I think our main focus is to make sure that person is comfortable, que la persona se sienta que tiene toda la atención. Hay muchos, como dice él, muchos lugares que 3, 4, 5 cirugías al día y entre esas cirugías los cirujanos tienen otros pacientes, lo digo porque también he trabajado en otros lugares y pues no, nosotros nos enfocamos en que ese día sea tuyo, o sea, que tengas toda la atención necesaria, que te sientas que te estamos cuidando porque es lo que estamos haciendo y que te estamos ayudando a llegar a tu meta.
Claro. And for example, when you guys do this like facelift and neck, how is that procedure? Like, is it also like under anesthesia?
No.
Or okay.
Yeah, we have the entire options of anesthesia available. So if somebody really doesn't want to have general, where they're totally asleep and the anesthetist is there doing their anesthesia, we have a couple different options available with local anesthesia and sedation, so that they're very comfortable. And that's again, part of the benefit of being a private office where we can control all these variables is if it takes us an hour or 2 longer, then we have that availability and that flexibility. And so patients, may need 4 or 5 hours for their procedure, and that's fine because we just start at 9 and we're done at 2 or 3. But if they want to have general anesthesia, they certainly can, but we try to make everyone feel comfortable and give them good pain control and take the time that's necessary to do a good job and make sure that they're comfortable.
Mira, eso está muy bien.
Ujú.
O sea que no tienes que estar ahí todo el día.
No.
Bueno, yo me imaginaba, ¿no? Yo nunca me he hecho esto, pero yo digo, a lo mejor tengo que estar de bien temprano cuando empieza mi cirugía hasta bien tarde que, no sé, termina a lo mejor un 8-hour shift.
Con
Pero lo que
nosotros
suena,
no, nosotros
no.
empezamos a las 9:10, no tan temprano, pues porque podemos enfocarnos en esa persona, no hay necesidad de que rápido vamos a terminar esto porque viene la otra, o sea, no. Y no es, no te digo, no es tardado, es algo que no esperarías estar todo el día, tener que hacerte 1000 de exámenes antes, o sea, no, eso con nosotros no es necesario.
And for example, what about patients who really want a surgery done, but they don't have the financial?
Sure. Yeah. Yeah, we have some like we offer some discounts for people. Like if we can utilize them in our marketing or our pictures and things like that, where they can showcase their great results. We do offer some discounts for that, and then there is something called care credit, where they can pay the cost of surgery over a longer period of time, interest free. And that usually is for 6 months, where they can pay off whatever the cost is without needing to incur a lot of interest or fees. Those are the two main ways to lower the cost of surgery. Yeah.
Do you want to mention that in Spanish?
Hay maneras para que se les ofrezcan descuentos. Si autorizan que usemos sus fotos y videos, los usamos en Instagram y les damos un descuento. Al igual contamos con una compañía financiera que se llama Care Credit. Pueden aplicar para que se les haga financing de la cirugía y no se les cobra interés por un periodo aproximado de 6 meses. Y pues eso, como dice, les ayuda para que no adquieran mucha deuda adicional.
And for example, if someone wants to get surgery, what age is it legal for them to get plastic surgery?
Yeah. Yeah, I would say, most of our patients are adults. Occasionally someone will come in for like their nose that's, 17 or 16 years old. But most people are, from 18 to even the late 70s. I had a lady recently that we did a tummy tuck for who had lost 100 pounds, and she's on our website and our Instagram. And several surgeons had refused to operate on her. They said she was too old. And I said, well, that's ridiculous. She's healthy.
Yeah.
She's a good candidate. I don't think age should be a discriminating factor for people. But in general, that's 18 to mid 70s or late 70s is pretty typical.
So for sure, you have to be 18 and adult.
You have to be
Yeah.
18.
Yeah.
Or
Or what
like
do
the
you think?
liquid
Unless-
rhinoplasty with parental consent.
Yeah,
You can
your
have that
parent
done.
has to sign for
Okay.
those types of things.
Okay, bueno, para las jovencitas ahí, no estamos diciendo que hagan esto, pero pues si su mami y su papi les dice que sí, ahí tienen que firmar nada más.
Yeah, I would just say, if you desire to have changes, and sometimes you just need a little help with certain things, or you want to kickstart your kind of, recovery after, let's say you've had a child, or you're a guy who's put on weight because they've got a little bit of a dad bod now. There's ways that we can help them with surgery that don't have a lot of recovery, that are very affordable and can really kind of kickstart their, journey back to where they want to be or what they envision themselves being.
Al igual yo quiero decirles que pues nuestra comunidad hispana poco a poco está aceptando más esto estético, las cirugías y así, y pues sé que es muy, no sé cuál es, comforting. Me imagino yo, si eres una persona que no habla inglés, no tienes a nadie que te apoye en esos momentos, que te pueda traducir, me imagino que se siente bien tener una persona hispana como tú ahí atendiéndote, contestando todas tus preguntas. Entonces pues aquí estamos, pues para
Que tienen
ayudarles
esa
en su
opción.
journey. Ajá.
Claro. You mentioned guys.
Yes.
Oh yeah.
Okay, this is interesting. So guys also get surgery.
Absolutely. Yeah, guys, I would say they probably make up about 20% of our patient population now, but it is growing because guys don't want to just be left behind by
Of
their
course.
pretty partners, right? So, whether it's their abdomen, their love handles, those are probably the big ones for men, or their chest that maybe they have gained weight and now they just don't know how to get rid of it, or they want to, go on that spring break trip and get back in their swimsuit and look good again. It's definitely something that guys are doing more of as well.
And remind me, what is this surgery called?
This is liposuction.
Okay.
Liposuction.
Liposuction.
I don't want to say the wrong word.
Skin removal for guys. Gynecomastia?
Yeah, gynecomastia. So like if they have more chest tissue than they would like, then you can do liposuction for that. And that's quite effective.
Entonces también para los hombres
También para
tenemos,
los hombres,
¿verdad?
Sí. También los hombres adquieren Botox, relleno. Tenemos de todo tipo de pacientes.
Mira, eso sí no me lo esperaba.
Sí.
Entonces, por ejemplo, si un hombre quiere hacer también ese tipo de cirugía, también él se recomienda que haga una consulta y se recomienda que haga algún tipo de examen.
Pues primero los vemos en consulta
Okay.
y ya dependiendo su historial médico, los medicamentos que toma, a veces no es necesario irte a hacer una cita con tu doctor de cabecera, creo que se dice.
Sí.
¿No? O sea, por eso queremos evaluar a las personas y ya luego le dejamos saber lo que se necesita para ellos también.
So what is the easiest way for your clients or your patients to reach out to you, especially a Spanish-speaking person?
Yeah, I would say on the website, we have an email link, and we're going to be working on getting a Spanish email link. But right now, if they just put their name and number, then we would have Anai give them a call so that there can be a Spanish conversation, so that they're not intimidated or wondering, they can ask questions and get more information that way. So through the website or through our telephone is another option, but we want to make sure we have a Spanish speaker available so that when we call them, it's not a waste of their time.
¿Nos quieres decir, Anaí?
Sí, por la página web pueden enviar un correo por ahí y ya yo me pondré en contacto con la persona que habla español. Igual pueden consultar en inglés si tenemos otra persona en la oficina que conteste esos inmediatamente. Pues también tenemos el Instagram, ahí pueden mandar un mensajito y ya él me hace llegar la información y yo me comunico con la persona.
Yeah.
Follow us on Instagram.
Yes, follow them on Instagram, you guys. And of course, también a nosotros, ¿eh? No se les vaya a querer nada más a ellos. Ok, bueno, Anaí, ¿y qué tal si alguien quiere una cinturita acá de avispa de sirenita?
Dr. Schneider es experto en eso. Sé que le llaman en otras partes la lipo 360. He trabajado con otros cirujanos que nada más te ponen, acostada en tu side, de lado, y así es como liposuccionan. Él no, o sea, él hace el 360, acostada en espalda, acostada de estómago y en los lados, y se asegura, él hace muy buen contour. Lo he visto miles de cirugías que todas las que hemos trabajado con él quieren que él las opere porque sí deja así una cinturita pequeñita, que sé que es lo que todas queremos ahorita.
Claro, ¿quién no? So you do that.
Yes, we really want to get people their kind of younger curves back, right? So whether it be making that waist nice and narrow, the abdomen totally flat, those two together, this liposuction 360 that people like to talk about, where we go all the way around their core or their abdomen, and just to really accentuate those curves. Not everybody needs to have like fat put back into their butt. If we make the waist really narrow and curvy again, then maybe you can avoid the fat transfer to the butt area, which is a little bit more higher risk, takes a little bit more time, has a lot of restrictions with it. So a lot of people will just, if we can get their waist back for them, they're quite happy.
No es necesario una transferencia de grasa. Sé que es muy popular también eso en estos momentos, pero con lo que él hace resaltan mucho más las curvas.
Yeah. Entonces no es necesario hacer ese tipo de cosas en los glúteos, ¿me explico?
Sí,
¿verdad?
en los glúteos
Ajá,
no es necesario. Con un buen contorno en el área de la cintura y las caderas resaltan los demás atributos.
Y por ejemplo, después de esta cirugía, ¿hay un tipo de masaje, tipo de faja, o qué es lo que se recomienda?
Nosotros proveemos las fajas.
Okay.
El día de cirugía le pongo la faja etapa 1 y ya a la semana las volvemos a medir para ver cómo van progresando y se les ordena una faja de second stage, se llama. Masajes son opcionales. No siempre es necesario un masaje, la persona misma la puede hacer en su casa y les damos esas instrucciones también. Pero pues sí, sé que hay muchas personas que lo hacen aquí también. Si se sienten más cómodos con eso, lo pueden hacer con cualquier persona. I'm just saying it's not absolutely necessary to go get a massage after. You can do it yourself.
Correct, yes.
And we instruct the people on how to do that, and then
Yep.
We provide first stage and second stage garments for the patients.
Right. Yep.
Nosotros proveemos todo eso.
Yeah, because within a short period of time, you're going to see those results really come to life. You know, even at their 1 week follow-up, you can already see a big difference. But then as people heal, you know, as the swelling goes down, as the bruising goes away, and they're starting to see those results 1, 2, 3, 4 weeks in, they're really motivated. And so it's sometimes hard in life to, you know, with all the temptations with food and drink out there, people just need to get, you know, their abdomen flat, their waist thin again, and this is a great way to accomplish that.
And then, for example, how long is this recovery? Typically, let's say once they're done with the surgery or the first week,
Yep.
how long does it take for them to be almost like to 100%?
Yeah, to 100%, I would say it's probably going to be, it's going to take some time, but it doesn't really limit their abilities to like go to work, take care of their family, or do those common activities that we all need to do around the house. We do, as I mentioned, have them wear a compression garment so that it, you know, this is a tight-fitting garment. After we take away the fat, it's going to be, the skin is going to be a little bit loose. We really want to push that down against the deeper tissues. So they're going to wear that compression garment. A lot of people say it's like they've done about 500 or 1,000 sit-ups. You know, it's sore, but it's not unbelievably painful or anything like that. They might need some pain medicine for a couple days after surgery, or maybe before they go to bed at night so they get a good night's sleep. We have them on a little bit of antibiotics to, you know, help them heal and prevent any kind of infections. But most people can get back to their normal life within a couple of days.
You'd be surprised. Algunas de nuestras pacientes regresan a trabajar a los 3-4 días de cirugía.
¿De verdad?
Toma tiempo para
Sí,
que
claro.
el cuerpo sane completamente. Lo inflamado, decimos que para el mes número 6 ya como que está completamente
Desinflamado.
Ajá, pero en realidad tarda hasta un año. Poco a poco, como el tiempo vaya pasando, la persona va bajando la inflamación y se va notando los resultados, pero no tienes que cambiar mucho de tu día a día. Solamente los primeros días estar reposando, tranquila y ya luego como si nada.
Entonces se pueden hacer la cirugía y a la semana ya pueden ir a trabajar, a ganar su
Pueden ir a
dinerito otra
trabajar.
vez.
Ajá, así es.
This is a fast recovery.
Yeah.
It's impressive.
And the best part is that, again, it's your body and it's under a garment, so you don't even really see it because it's being compressed. And, you know, those garments fit under your clothes. So a lot of people, you know, they'll see, oh, maybe you're looking a little bit thinner or better, but they don't know that you're still recovering from surgery. So it's almost like a little secret.
Yeah.
You know.
So they want to reveal it.
Exactly.
So, for example, do they have to, I don't know, I mean, I don't really know exactly what tools you guys use or if there's any stitches that have to be done?
Usually not for
No?
liposuction.
Not for
This is done through just these little access points. It's about 4 millimeters, so quite little.
Okay.
And those kind of heal from the inside out. So no stitches are generally needed for those.
Okay. So it's not like you're going to bleed as the days goes on.
Nope. There's going
No?
to be some fluid from the surgery that leaks out, but we give them a garment and ways to kind of absorb that fluid.
Okay.
Yeah.
What about infections? Are you more prone to infections?
Be very unlikely to get an infection
Okay.
because we have them on a preventative antibiotic, and because we're, you know, everything is done in a clean fashion, we can really, you know, reduce their. I've had very few infections. It just really doesn't happen as long as they're doing the kind of standard procedures after surgery.
Of course.
Tienen que tener esos cuidados, como todo, pero damos antibiótico y pues les damos las instrucciones de cómo cuidar esas áreas también
Para prevenir la infección.
Prevenir infección, sí.
Mira.
Yeah. Usually, like in the summer, we don't want people like going swimming or going into a hot tub or anything like that for a couple of weeks until the little access points have closed. But otherwise, it's, you know, most people just take Tylenol, maybe ibuprofen after, you know, 2 or 3 days of surgery, and so it's well tolerated.
And then how long do you see the results? Like, I know you mentioned like maybe after 6 months you're still a little bit swollen, but then I don't know how many years until you're like, oh shoot, I think I need another surgery. Or how do you prevent
Yeah.
from that happening again?
Well,
they don't want to get another
the fat is gone forever in those areas. So let's say they did gain a bunch of weight. They're going to gain it back preferentially in other body areas and not in the area that we've done surgery on. We always encourage them to kind of stay within, 5 to 10 pounds of their surgical weight, though, because we just want them to be healthy and kind of maintain the results as best they can. Some people, it's quite often that they'll actually lose weight after surgery because they're so happy with their results.
Yeah.
They're really motivated,
So it also plays a big role in like the mental, I would say, or I wouldn't say the mental.
Confidence.
Confidence.
It
Yes.
boosts confidence.
Definitely.
Las personas se
Definitely.
sienten mucho más seguras después
Sí.
de una cirugía y les da mucha motivación para cuidarse de la manera que deben de para maximizar los resultados.
Claro.
Sí.
Mira, entonces eso también ayuda pues con nuestra confianza y
Sí, y
sentirnos
como
mejor.
dice él, si llega a subir de peso la persona, no va a subir de peso en el área donde le hicimos la liposucción, porque no pueden generarse nuevas células. Entonces, por ejemplo, hay que decir que se hacen los brazos y el abdomen. Si van a subir poquito de peso, a lo mejor les sube un poquito las piernas, que es beneficial para otras. O sea,
Sí,
en esa área
claro.
no vuelve a
Entonces,
notarse mucho.
donde tú te hagas la cirugía, ahí ya la grasa no regresa, pero regresa en otras partes.
Ujú. Es que si
Mira.
quieren háganse todo el cuerpo
Sí.
y así ya no hay
Ya no regresa.
I said about the fat cells how they don't.
Yes.
I said so just get your whole body.
They
done
don't
that
come
way you
back.
won't.
Some people, there's a lot of different areas. I basically tell them if there's pinchable fat in an area that they don't want, we can get it. So
Every area.
Muchos beneficios tiene una cirugía entonces. So a lot of benefits that we have with the surgery.
yes, absolutely. Yeah.
Chicas y chicos, no pueden entonces decir que no quieren hacer cirugía. Si es que le da miedo, miren, aquí tenemos a Anaí, tenemos al cirujano que les puede contestar todas las preguntas necesarias para que ustedes se puedan sentir a gusto. Y recuerden que cuando ustedes hagan su cita, pues ellos le van a contestar todas las preguntas. Y el día de su cirugía, ya si llegan ese día a hacerla, pues nada más va a ser para ustedes. O sea, la atención la van a tener ustedes y nadie más, ¿eh? Así que yo creo que ese es como un servicio de 5 estrellas. ¿Verdad? The best of the best service.
Best of the best
Because they're catering
services,
to them.
personalized care.
Right.
Sí.
So, what about mommy makeover?
Yes, mommy makeovers are quite popular. Now, I don't do any kind of breast augmentation at this time or breast lifts, but a lot of moms want to get their abdomen and core back so that they can kind of feel like they did before they had children, but now with the new benefit of having children. So, again, getting that waist and those curves back so that they feel sexy and desirable again. Because a lot of people struggle with that after they have children, or the children are getting to be a little older and now they're kind of feeling like they're a little bit left out. Getting that confidence back so that they can get out there, go dancing again, be with their family and friends. So the mommy makeover is kind of a concept of where usually we're treating the core, their abdomen, their waist. Some, are getting, breast augmentation or lifts. I don't really do that. I really kind of focus on the core at this point, but that would be quite common. They're probably our number one patient, actually, the women that are in that kind of 30 to 50-year-old age group where they just kind of want to get their bodies back.
And then, for example, let's say that you give birth, right? How long should you wait until you're like, you know what, I want to have a mommy makeover and I want to make that appointment, surgery, and done?
Yeah, I would say enjoy your new gift and child, but it's not uncommon that people maybe after like 6 months, their body has recovered from that. I always encourage them, okay, if they're going to have more children, you might as well wait. Some say, well, I won't gain as much weight the next time. And that would be true because the fat will be gone. So if they do get pregnant again, certainly it's not going to come back in their abdomen. Or they've had a C-section, and so they have an incision that they don't like, or that they have extra skin, or what do they call it, like a fupa? Where they can't, they can't wear their bathing suits again. They feel uncomfortable. They're lacking that confidence, and so that's quite common. Yeah, that would probably be, I don't know, at least 50% of the people that get liposuction and tummy tucks.
¿Quieres hablar un poquito de eso?
Pues para las nuevas mamás recomendamos que esperen mínimo unos 6 meses antes de venir a que tengan su cirugía. Él por el momento no está trabajando los implantes o levantamiento de senos, pero para su Mami Makeover se enfoca en esta área que es el abdomen, la cintura. Hay muchas que tienen cesáreas y les queda una cicatriz que no les gusta. Removemos la piel y se hace una incisión muy baja, les queda la cicatriz, o sea, súper baja, pueden usar sus trajes de baño y todo eso. A las que les queda como dijo el FUPA, o el Mami Pouch, se puede liposuccionar o con remover la piel, ya que se aprieta todo, ya no es notable. Entonces es en lo que más se enfoca él en el Mami Makeover.
Yeah. So yeah, some women we need to remove the extra skin. Others, if they have pretty good skin, they don't have a lot of stretch marks, we can just take away the fat and then use that compression garment to really tighten that skin up again.
And is that also like a fast recovery surgery? Like within days or weeks they can go back to work?
It takes, everyone's a little bit different in terms of how they recover from surgery, but by and large, after about a week of that kind of surgery, you can do most things. I just tell people, don't lift too much, don't bend, don't do a lot of twisting, kind of let your body recover, and then just listen to your body. If it gets, swollen after you do a little bit too much exercise or walking, then just take it easy.
Para la recuperación, entre más actividad hagas después de la cirugía, se va a tardar un poquito más tu recuperación. Entonces sí pedimos que se la lleven tranquilo, o sea, que no se agachen, que no levanten mucho peso, usualmente por las primeras 2 semanas, y a las personas que sí les gusta hacer ejercicio y así les pedimos que esperen 6 semanas antes de regresar a su rutina de ejercicio. Pero la recuperación no es muy tardada. Sé que muchas personas usan drenes. Dr. Schneider lo toma por persona dependiendo en cómo ve tu cuerpo a la hora de la cirugía. No todas van a tener drenes y es personalized care. Es todo dependiendo a ti y tu persona.
Entonces, dependiendo qué es lo que necesita el paciente.
Sí, así es.
Okay. Entonces, no hace lo mismo para todos, ¿eh? O sea, él va dependiendo a qué es lo que tú necesitas, qué es lo que tu cuerpo ocupa y, obvio, a qué meta quieres llegar, ¿no? Con tu cuerpo. Claro. Bueno, chicos, si vieron hasta aquí, hasta el final, creo que agarraron muchísima información y, pues, ya saben, pueden contactarlos a ellos, especialmente en Instagram. Do you guys want to tell us what your Instagram is?
Yes, our Instagram is Riverview Facial Plastic Surgery. And the website also is a great source of information. There's a lot of good before and after photos, videos showcasing patients, kind of journey through their healing. So those two are great sites. And then, of course, there's contact page there so that they can send an email to set up a consultation.
Bueno, chicos, ya lo tienen. Entonces, esa información aquí va a salir. Y pues también, por favor, no se les olvide de seguirme a mí en mi Instagram, que es LizJordan25. En Facebook como Lisbeth Jordan. Igual en TikTok. Y también, obvio, al punto MN, porque pues ya ven, aquí traemos a gente de todo tipo de servicio. Como pueden ver hoy, fue una entrevista muy interesante que creo que a todos ustedes les va a beneficiar, especialmente hombres y mujeres y a mamis que ahí se quieran hacer un Mami Makeover, pues aquí tienen toda la información. Well, thank you again, you guys, for coming and sharing everything that you guys do. And I think this is a great thing for our community to learn.
Thank you.
Bueno, chicos,
Gracias.
Adiós.
Gracias.
Good job.
It wasn't that bad, right?
You guys did great. Yeah, that was good.